Hi guys, today we learn about apoptosis. This is a very important topic. Each and every word in this topic is important. So let's begin. First, apoptosis is a caspase dependent programmed cell death. Example, Councilman bodies embryogenesis. Where we see Councilman bodies? Acute hepatitis. Now, in apoptosis, there is phosphatidylserine flip. Usually, in cell, the receptor for phosphatidylserine is inside the cell. Now, when there is apoptosis, the phosphatidylserine receptor expressed outside the cell. Okay. Now, the marker for apoptosis is annexin 5. Annexin 5 is marker for apoptosis, but annexin A1 is marker for hairy cell leukemia. How to remember? 5 looks like A. 5 looks like A. And hairy cell leukemia. H-A-I-R-Y. A-I-A-I. In apoptosis, there is cell shrinking and intact plasma membrane. And cell shrinking, this is the earliest feature of apoptosis. And this is very important, no inflammation. Earliest feature is cell shrinking. As I previously mentioned, earliest feature is cell shrinking. But most important or most characteristic feature is nuclear chromatin condensation. Apoptotic bodies composed of cytoplasm, cell organelle, plus minus nuclear fragments. Okay. Now, apoptosis can be physiological or pathological, but necrosis is always pathological. Now, apoptosis, there is intrinsic pathway and extrinsic pathway. These are the keywords, and these are very important. In intrinsic pathway, there is cytochrome C leakage. APAP1 is activated, caspase 9 activated, caspase 3, 6, 7 activated, and inhibitors of intrinsic pathway is IAP. How to remember? The main caspase of intrinsic pathway is caspase 9. I is 9th letter and caspase 9. Easy. Now, caspase 3, 6, 7 is common for intrinsic as well as extrinsic. But caspase 9 is very important for intrinsic pathway. Now, inhibitor of intrinsic pathway is IAP. How to remember? Intrinsic pathway. I for intrinsic, I for IAP. Now, the extrinsic pathway. It is initiated by TNF1 fast ligand, which is CD95. Molecular marker of apoptosis is CD95. And caspase 8 is activated. It is the most important caspase of extrinsic pathway. How to remember? E for extrinsic and E for 8. E for extrinsic, E for 8. Okay, easy. Now, the inhibitor for extrinsic pathway is flip. How to remember? F. E next letter F. E next letter F. Okay. Now, in electrophoresis, there is stepladder pattern in apoptosis. This is the stepladder pattern. And smear pattern is seen in necrosis. This is the smear pattern. Now, the genes for apoptosis. There are pro-apoptotic gene, there are anti-apoptotic gene. Pro-apoptotic means which helps in apoptosis. Anti-apoptotic means which prevents apoptosis. Pro-apoptotic genes are BAX, BAC and P53. Anti-apoptotic genes are BCL2, BCLXL, MCL1. How to remember? In anti-apoptotic gene, in every OR there is L in the end. L in the end. BCL, BCLXL, MCL. Okay. So, a quick recap. Apoptosis means caspase dependent programmed cell death. Examples are Councilman bodies in acute hepatitis, acute viral hepatitis and embryogenesis. There is phosphatidylserine flip. Marker of apoptosis is annexin 5. There is cell shrinking, intact plasma membrane. There is no inflammation in apoptosis. Earliest feature of apoptosis is cell shrinkage. Most important or most characteristic feature of apoptosis is nuclear chromatin condensation. Apoptotic bodies composed of cytoplasm, organelle plus minus nuclear fragments. Apoptosis is either physiological or pathological. Apoptosis, there is intrinsic pathway, extrinsic pathway. In intrinsic pathway, there is cytoplasm C leakage, APAF1 is activated, caspase 9 activated, caspase 3, 6, 7 activated, and inhibitor of intrinsic pathway is IAP. In extrinsic pathway, there is TNF1 and FAS ligand is activated, caspase 8 is activated, caspase 3, 6, 7 is activated, inhibitor of extrinsic pathway is FLIP. Okay. Now, stepladder pattern is seen in apoptosis, smear pattern seen in necrosis. Genes. Pro-apoptotic genes are BAX, P53, anti-apoptotic genes are BCL2, BCLXL, MCL1. Try to remember the anti-apoptotic genes. So, these are the important points about apoptosis. If you like this video, please like, comment, share and subscribe. See you in next video. Tata.